Heart rate jumping up and down, causes and treatment. In adults, a typical resting heart rate is 60 to 100 beats per minute, but structural or electrical disorders of the heart can cause it to rise or fall. Medications, a lack of sleep, and stress may also affect heart rate. A person's heart rate may be lower when they are sleeping or higher during exercise. However, some people have an irregular heart rhythm that causes their heart rate to jump between high and low. This condition is called arrhythmia or dysarrhythmia. It can be alarming, but it does not always result in severe health complications. Nonetheless, if a person suspects anomalies in the rhythm of their heart rate, they should contact a doctor for a diagnosis. This video will examine several possible causes of a heart rate that is jumping up and down, beginning with some structural and electrical disorders of the heart. It will also detail possible behavioral and environmental causes such as stress and dehydration, and explain when a person should contact a doctor. Tachycardia. Tachycardia means that an adult's heart rate is over 100 beats per minute. There are several types of tachycardia. Sinus tachycardia. In sinus tachycardia, the heart rate increases but continues to beat properly in the normal rhythm. Sinus tachycardia occurs when the heart rate increases due to expected reasons, such as during exercise, if a person is feeling anxious, or during periods of dehydration. Inappropriate sinus tachycardia, which is rare, occurs when the heart rate increases for no apparent reason. It could be the result of a nerve signaling problem in the heart. Supraventricular tachycardia. Supraventricular tachycardia can happen when there is a problem with the heart's electrical circuit, or a heartbeat originates in the atrium outside of the sinus node. This prevents the heartbeat from originating in the sinoatrial node, which creates sinus rhythm. Instead, it causes it to originate in another part of the top chamber of the heart. The word supraventricular means that the arrhythmia originates from the top chamber of the heart. The word tachycardia means that it results in a heartbeat that is higher than 100 beats per minute. Symptoms. Supraventricular tachycardia may cause symptoms such as palpitations, chest pain or discomfort, weakness, lightheadedness, fatigue. However, there may be no symptom at all. It is rare that supraventricular tachycardia results in sudden death, but this can happen if the heart rate gets too fast. Treatment. According to the American Heart Association, a person with supraventricular tachycardia who wishes to slow down their heart rate can try several types of Valsalva maneuver. To try the most well-known type of Valsalva maneuver, a person should bear down as if they are passing a bowel movement for 10 to 15 seconds. However, if this method does not work, they can try the following other types: coughing, immersing themselves or just their face in cold water, blowing on their thumb for children, or into an empty syringe. Atrial fibrillation. Atrial fibrillation results from erratic signals in the upper chambers of the heart, causing an irregular heartbeat. It is a common arrhythmia. Symptoms. A person with atrial fibrillation may experience heart palpitations, shortness of breath during exercise, exercise intolerance, lightheadedness, difficulty breathing when resting, fatigue, chest pain. According to some studies, females with atrial fibrillation are more likely to experience symptoms than males. Treatment. Treatment for atrial fibrillation may include medications to manage heart rate or heart rhythm such as beta blockers, calcium channel blockers, antiarrhythmic drugs, blood thinning medications to reduce the risk of stroke, invasive therapy such as an ablation procedure, pacemaker surgery with a nodal ablation procedure, an open heart maze procedure, a type of ablation surgery wherein a surgeon creates scar tissue in the heart to affect electrical impulses. Conduction disorders. Conduction disorders, especially heart block, can cause a disruption to the electrical signals that enable the heart to pump blood to the body and the lungs. This disruption affects the rhythm and rate of the heartbeat, and as a result the heart may not pump the amount of blood necessary for the body to function. Symptoms. According to the National Heart, Lung and Blood Institute, a person with heart block may experience the following symptoms: fatigue, dizziness, a slow heart rate, shortness of breath, heart palpitations, chest pain, abdominal pain, nausea, fainting. Treatment. Treatment will vary depending on the type of heart block a person has. For milder forms of heart block, a person may only need monitoring by a cardiologist. People with higher degrees of heart block will need a pacemaker. Dehydration. If a person does not consume enough water, their body may become dehydrated. Symptoms. Dehydration can affect a person's mental and physical function, including their heart rate. According to a 2019 review, some other immediate symptoms of dehydration include decreased exercise performance, decreased thinking abilities, mood changes, fatigue. In the short term, according to the same review, dehydration may cause an increase in heart rate for the following reasons. It can affect the function of the endothelium, which is the lining within the heart and blood vessels. It can affect the sympathetic nervous system, causing changes in breathing and heart rate. It can affect the body's ability to regulate blood pressure. A person may notice this if they feel lightheaded when standing up. If a person is dehydrated over a long period of time, their risk of developing problems such as heart disease increases. Treatment. As well as drinking water, a person can boost their water intake by eating plenty of fruits and vegetables. If symptoms of dehydration occur, oral rehydration solutions can provide electrolytes quickly, enabling fast absorption. If these methods do not provide relief and the symptoms become severe, a hospital can provide intravenous fluids. Medications. Certain drugs can affect the heart rate and cause the rhythm to jump between high and low beat rates. Some types of medication that can cause arrhythmia include anesthetics, antiarrhythmics, antibiotics, anti-cancer medications, antidepressants, thyroid medications, stimulant medications. Lack of sleep. Sleep deprivation, sleep disorders, and lack of good quality sleep can have negative effects on heart health. Symptoms. Getting enough rest is important for the body to function properly. Some symptoms of sleep deprivation include fatigue, irritability, difficulty concentrating, diabetes, inflammation. Insufficient sleep may increase the risk of developing conditions such as high blood pressure and obesity. Sleep deprivation may also contribute to atrial fibrillation, but doctors need more research to confirm this. Treatment. Adopting the following habits may contribute to better sleep: reducing caffeine intake, developing a set bedtime routine, getting enough physical activity during the day. Stress. Interactions between the heart and brain cause the body to respond to emotions such as anger, depressed mood, and stress. Response levels differ from person to person. Emotional or physical stress can lead to a faster heart rate, a rise in blood pressure, a release of stress hormones. As a result, the heart has to work harder. In some people, this can increase the risk of arrhythmia, a heart attack, and other heart-related health issues. Females appear to be more susceptible than females. Taking measures to manage stress can help reduce the risk of heart-related complications. Symptoms. Stress can cause a range of physical and mental symptoms including worry, feeling overwhelmed, headaches, increased heart rate, nausea, fatigue, insomnia. Treatment. Managing stress can be important in reducing the risk of developing arrhythmia. Stress relief and relaxation techniques such as meditation can be effective forms of treatment for chronic stress. When to contact a doctor? If the rate or rhythm of the heartbeat becomes irregular or is causing distressing symptoms, it is important to seek medical attention. Even if there does not appear to be any danger, a doctor can provide assistance in reducing the risk of complications. If a person is experiencing the following symptoms, all of which are symptoms of a heart attack, someone needs to call for emergency medical services. Chest pain, shortness of breath, dizziness, a feeling of impending doom. Pain in the following places: neck, one or both arms, back, jaw, stomach. When should I worry about my heart rate spikes? A person may experience small or slight jumps in heart rate due to factors like stress, exercise, changing positions, and some foods. However, if a person's heart rate regularly reaches over 100 beats per minute with no apparent cause, it feels irregular. They experience high spikes in their heart rate, or they notice any other symptoms alongside the high heart rate, they should seek medical attention.